So doctor, do you think prolonged rectal bleeding will be a sign of rectal cancer?
Yeah, definitely. Rectal cancer, rectum is a part of the alimentary tract or large bowel, where the last 15 centimeters of the bowel where we pass stools, no, that is called rectum basically. And rectal cancer is one of the most common cancers in the GA, that is alimentary tract. And bleeding per rectum is a very common symptom, actually speaking. Like around 20 to 30% of the population will have bleeding per rectum, but there are so many other causes for bleeding per rectum, like fissure in the anal canal, hemorrhoids, and cancer or other benign tumors, normal non-cancerous tumors also. But even though the normal causes are there, still if there is a bleeding per rectum, it is better to get it evaluated by a clinician or a doctor to make sure it is not cancer, and especially if it is consistent and persistent with regular medication, if the prolonged period of the bleeding is there, that definitely it shows that there is something wrong and it might be the symptom of a hidden rectal cancer. And the importance why you should be it should be observed or you should be examined early is, if you can detect the rectal cancer early within the stage 1 or 2, where in early stages of this thing, treatment options are very good and results are very good, like survival, that is life is near normal if you can do it early. And the surgery wise, treatment wise, coming to rectal cancer is mainly treated by surgery, wherein we remove the part of the rectum with good margin beyond the tumor, we remove it and then we can rejoin the bowel to become normal, to facilitate the normal passage of the stools. In this procedure can be done by open surgery, laparoscopic surgery, and the robotic surgery. Laparoscopic and robotic surgery have a good advantage of lesser hospital stay and better oncological outcome, and patient recovery to the normal life is very fast. After the surgery, based on the findings, like after the surgery we remove the specimen tumor, then we submit it for the histopathology examination. Based on the final report, there might be requirement of radiation therapy after the surgery or chemotherapy. Usually chemotherapy will be required for a period of time up to 6 months to 1 year, that to prevent the recurrence of, that is to prevent re-emerging of the cancer in rectal. And sometimes if the disease is little bit advanced, what we can do is we give radiation therapy initially to treat the cancer and make it smaller, to make it operable, that means to make it remove completely by surgery. Then after the certain period of radiation, then we can subject it for surgery. Overall results wise, it has a good outcome with early detection and proper, and there is a screening available for rectal and colon cancer, where we can do colonoscopy and stool testing for presence of traces of blood in the stool in asymptomatic patients, and sigmoidoscopy, wherein we just check the 30 to 40 centimeter of the distal last 30-40 centimeter of the alimentary canal. This is how we can detect very early before the occurrence of symptoms.